With a national footprint that includes 134 hospitals, 245 home health locations, and 83 hospice locations in 37 states and Puerto Rico, the company is committed to delivering high-quality, cost-effective, integrated care across the healthcare continuum. Encompass Health is ranked as one of the Fortune 100's best companies to work for. That's awesome. Congratulations. Here in Mesa, Encompass Health Rehabilitation Hospital of the is a 70-bed inpatient rehabilitation hospital that offers comprehensive inpatient services. Encompass Health East Valley is accredited by the Joint Commission and has disease-specific certifications for amputee, brain injury, Parkinson's disease, and stroke rehabilitation. Serving patients throughout the East Valley, the hospital is located at 5652 East Baseline Road, and you can learn more about Encompass Health at encompasshealth.com/East Valley Rehab. And April is National Parkinson's Awareness Month, and today we have Celeste and Santian.
Okay. Yes.
Physical therapist with a neurological specialty, and Diane Cornier, a certified rehabilitation registered nurse, to discuss Parkinson's disease and the impact to a person's function and how rehab specialists help. A couple of foundations have been formed to educate, bring awareness, and develop a cure for Parkinson's, such as the Michael J. Fox Foundation and the Muhammad Ali Foundation. And currently there is a bear challenge circulating for the month of April locally here to bring awareness to these foundations. So welcome, ladies. Appreciate you being on the call, the Zoom call as it is today. Let's talk about what Parkinson's is, because not everybody understands that.
Well, Parkinson's is a disease that affects the neurological system. It's usually a central issue. So there's a part of your brain that produces dopamine, and your brain no longer releases a large amount of dopamine, or it doesn't release as many molecules of that chemical in your body. And as a result, you end up having this dopamine usually helps signals move quicker. So like if I want to move my hand like I'm doing right now, dopamine is released into my system and it's able to send that message down to my arm to move it as I please. And since people who have Parkinson's disease, they lack that chemical in their brain, they move a lot slower, they have less control of their body, react slowly to, like if they're falling, they can't react quickly to step back. There's still a lot of studies and research going on. They really don't know the exact reason for Parkinson's, but they speculate that it could be environmental. So they found out that usually a lot of people can get it if they live like around the Northeast or the East Coast. Sometimes what they're believing is that it could be contributed to like maybe the factories that were over there, like the chemicals and the toxins in the water and the environment. And there's another theory that it could be just possibly genetic, but it's not as common. Usually around 20% will be within the family, like genetic. So real cause is not really known at the moment.
Which is scary.
Yes.
Yes.
Okay. Well, talk about some of the symptoms of Parkinson or Parkinsonism.
Sure, I'll talk to that. So some of the symptoms that we'll see a lot of the times in the hospital when patients come to us here either have a current diagnosis of Parkinson's or are beginning to show those Parkinsonian type symptoms. Parkinson's is a very symptom-driven disease as far as the objective from the patient, what they're experiencing. So they can begin to experience any kind of tremors of the hands, of the feet. Their gait can begin to shuffle, which just makes them more at risk for tripping and falling. It's a movement disorder, so it just causes that lack of dopamine, causes a slowness of movements all around, slows the internal organs as well. Also just poor balance and coordination in general, any kind of speech difficulties, it slows their speech a little bit, as well as any kind of swallowing difficulties. Patients will begin to notice that they have a hard time swallowing liquids or foods, and will begin to have choking issues. So they then will begin to seek out with their primary care physician to hopefully get paired up with a neurologist and then go further into the diagnosing process.
Got it. Is there a cure?
At the moment, no. That's why we are continuing to give our efforts and our funds to the foundations that are currently here locally to begin to work on a cure. There are a lot of advancements in the medication that help to essentially control a lot of those symptoms, the tremors, kind of speed up movements a little bit to make a person more functional. But at this point, no cure yet.
Wow, that's scary. Well, what can rehab do to help with patients that are affected by Parkinson's?
And that's one of the things that could help. Rehab and exercise can help delay the process or the progression of Parkinson's disease. So when you exercise, you actually release dopamine into your body. So exercise is doing that, or at least helping the dopamine stay inside your brain. It will also help with flexibility, because a lot of people who end up having Parkinson's disease don't move as often or as much. So they end up being like with rounded shoulders, forward head. They get like turn into like start curving and turning
real stiff.
So just big and loud movement, big and large movements will help the trunk, the vertebrae, everything move, your joints move as well, bring circulation to the brain as well to send signals a little bit quicker. And then there's also like the deep brain stimulators that you can discuss with your neurologist. And from what I've been told from a surgeon that does that, they say that those are more appropriate for people who have a lot of tremors, and doesn't really make much of a change for the other symptoms that you experience with Parkinson's.
So would those actually be implanted?
Yeah, you have electrodes in your brain, and there's like another machine inside around your chest, I believe, and then they stimulate your brain every so often.
It's a surgical procedure and helps with those that have debilitating tremors. Definitely something to consider as the disease progresses further.
Well, what advice would you give to family members of someone who's affected by Parkinson's?
I would just say it's important to make sure that for one, if it runs in the family, to be aware of the symptoms to be on the lookout for. Like we talked about, shuffling gait, difficulty with speech, swallowing, all of those things can be early signs. But to also make sure that they are getting connected with their primary care, that they have a primary care doctor, and to go get seen early with a neurologist. There's no harm in getting paired with a neurologist to monitor. It's better to monitor those symptoms than to not have somebody over it. And to encourage exercise, to make sure that you're just encouraging movement. That's the best. It's not a cure by any means, but it's probably the best preventative medicine for Parkinson's is to continue to do low impact exercise.
Well, thanks for this information. How are you guys actually, what are you doing for Parkinson's Awareness Month? I mean, is there something special that you are doing within your campus facility?
So she's actually teaching a class tomorrow.
Oh, great. Okay.
Yeah, it's called Power, PWR, and then exclamation point. It was actually developed by a therapist from Tucson. And it's just a lot of large, big movements, trying to promote big movements, because like she said, like there's a lot of shuffling, a lot of like
small
movement, there's tremors. So these type of activities will help them improve their posture, mobilize their whole spine and joints, just get the heart pumping as well. So we're doing that.
We've planned a few events through the months. We also participated in the Bear Challenge. So the Bear Challenge is an organization that was founded by, I believe his dad had Parkinson's, but the whole premise is to encourage any kind of exercise or movement. Right now it's something floating around on social media to call people out to perform 30 seconds of active exercise. We used boxing. Boxing has been proven to be a really good exercise for Parkinson's to promote that hand-eye coordination. So it's a challenge to encourage people to exercise, take a little 30-second clip to post it. You can call anybody out to bring awareness to that Parkinson's. But we're doing that. And then also having a loud class by one of our speech pathologists next week. So kind of a few events throughout the month to kind of help our staff as well, help our Parkinson's patients at the bedside as well.
That's awesome. Well, thanks for being on the call today. Anything else you want to mention?
I'll mention some community resources that are great.
Sure.
Just locally. We talked about boxing. So there is a place called Rocksteady Boxing in Mesa, which serves specifically Parkinson's patients, which is an awesome resource for families as well as those who have currently have Parkinson's. Also, we've got the Muhammad Ali Parkinson Center, which is up in Phoenix, the Banner Neuro Wellness Center, and then here at Encompass Health, we host the big and loud classes. Hopefully after things begin to open with COVID, we will begin to host those as well.
If we get back to hosting those classes again, I actually will be teaching them as well. So,
well, it's when you get back to it will happen, right?
Yeah.
That's positive. Okay, again, how do people find you?
So Encompass Health East Valley Rehabilitation Center. You can find us on Facebook as well as on our website. Welcome to drive by and take a tour at any time. We are allowing visitors now in tours, and we'd be happy to serve anybody coming in with Parkinson's. Awesome.
All right, ladies, thank you very much for being on the call with me today, and hopefully we'll see you again on another call on another subject.
All righty. Thank you so much.
Thanks.